Well, let's go ahead and talk about health plans. So, with direct primary at the core, then what we're able to do is create a variety of health plan options for a company. Now, these plans are customized to your employees' needs and their budget, and we can also incorporate it in different ways. So, the multiple ways that we can incorporate direct primary care is going to be either on a standalone basis, where it's just the direct primary care. We can also incorporate it when it's paired with a level funded or a self insured health plan. We can also utilize health reimbursement arrangements, which is really exciting. And we're going to go over all the different ways that you can do that in an HRA. So it's tax beneficial for employers. You can also implement it in conjunction with an individual coverage HRA. And then we also have some association plan options. It's not a true association plan, but when we're talking about associations, we're talking about brokers pairing with associations to offer MyMD Connect to a larger group of people at a discounted rate. So we've been seeing a lot of brokers that are working with associations, and instead of offering the traditional medical plan association plan, we're offering direct primary care instead. So that's a great option for employers as well. So let's kind of go over then and begin by just discussing the Connect Health membership. So there's two different types of memberships that are available. We have the VPC, which is our virtual primary care, and then our BAM, which is our brick and mortar. So you'll see that within here, there's two different memberships. Each one has preventative care that's discounted. On the virtual, you get 100%, virtual visits, and that's the same on the brick and mortar as well. So you can see your doctor as many times in a year as you want, and that's going to cost you $0. It's included in your membership. Now, if you have the brick and mortar, then what we are able to do is include where you can see your doctor face to face as many times in a year as you want as well. And that is going to cost you $0. So that's the difference between your brick and mortar and your virtual primary care. In addition to this, we have direct primary care discounted programs with your basic labs, your x-rays, imaging, things of that nature. And what that DPC discounted means is that our doctors are able to get those different services at a wholesale price and give you guys that wholesale price. So it's cutting the price for employees. And then if you are on maybe a traditional health plan option, you're able to get that cost reduced as well. So that's really exciting. So that's the two different types of memberships that we do have available. If we are available in all 50 states. That is something I did want to make sure that we touch on. We are available in all 50 states. We have doctors all over the place for brick and mortar locations. However, that's not to say that we have a doctor at a brick and mortar location in every city. That's not the case by any means. But we do have the opportunity, if you have a specific area that has a large enough population, we do have the ability to recruit doctors for brick and mortar upon request. But once again, it kind of depends on that area as well. But at a minimum, on a virtual basis, we can work in all 50 states. So that's very exciting. In regards to the price of our Connect Health memberships, you'll see here it does depend on group size. So the larger the group, of course, the lower the price that is. So you can see here the cost differentiators between the virtual and the brick and mortar. One thing that I did want to note on price, though, is that for a group, the employer must pay 100% of the employee only premium. Well, I can't even say premium membership fee, I guess. So the employer must pay 100% of that employee only. If the employer wants, they can cover the cost of the family as well, or they can pass on that additional cost to the employee. But one thing about ours is we do request that at a minimum, the employer pay for the employee only. So this is the cost of those programs. A lot of times we see just the program of direct primary care implemented for groups a lot of times that maybe don't offer any benefits at all. You have less than 50 employees. You're looking at, wanting to implement something on a standalone basis. So this is an opportunity. Or if maybe self-funding or level funded isn't really going to be the best option for your group and you have more than 50 employees, we can also look at pairing this alongside of a fully insured plan as well. You will see, of course, those claims dollars reduce because of the fact that a lot of that is being cut out of your plan because those claims dollars aren't coming in. They're all, being funneled through MyMD Connect and included in your membership fee. So there are savings that are available, but we do usually see the employer groups that really want to save a lot of money look at implementing those level funded or self-insured plans. So let's go ahead and take a look at what that looks like. So if you want to incorporate this alongside of a level funded or self-insured plan, we can either work with, a company that maybe you're already working with, or we can also, if you kind of consider us like a broker's broker, we can work with different TPAs to make sure that we get a plan that's going to work the best for you. I know that we have several TPAs that we already work with where they have it intertwined within their plans already. And so we have a lot of those relationships. And when it works that way, it's great because the employee, really just has a seamless experience. So we're able to implement that with level funded or self-insured plans. We are seeing that when we implement it with a level funded or a self-insured plan, that we are seeing a decrease in cost on that plan of up to 30%. So it's extremely impactful when this program is implemented. A couple of case studies that I did want to, quickly overview, and I don't want to spend too much time digging into this, but there was an organization that we had here in Texas. They actually implemented our brick and mortar. It was around 208 people, and we were able to generate 18% total savings on their health plan by saving them $423,000 and giving them a 5.5 times return on investment. So this is one where we had the brick and mortar, so employees were able to go face to face as many times as they want. I will say, though, if COVID has kind of taught this industry anything, there's a lot of lessons that have come out of it, but one thing is that the virtual and implementing virtual care is also extremely successful as well. And so I have included one here. This is actually a multiple state virtual direct primary care example that we did have. So we were in multiple states on this one. And since employees now are more comfortable with virtual, it's really easy to implement, and we're seeing even more success with these programs. But this was a group that was multi-state and had 700 employees, and they were able to save $2 million in savings. So that was a 4.4 times return on their investment. So these are some real examples here of how impactful this can be when it is incorporated into those plans. So the next thing I did want to discuss is, hey, what if you have an employer group that maybe isn't offering anything at all, has less than 50 employees, and they're looking for some sort of a solution to give to their employees? What we've been able to do is create and put in our plans into an HRA. I know most of you are probably used to the traditional HRA, which is, hey, maybe we're going to buy down the deductible, or employees, here's your medical plan, but we're also going to contribute an additional $500 or $1,000. Use it with what you want, or you can be as specific as you want because it is self-funded. But what we were able to do then is build into an HRA our direct primary care, as well as give different options to add, such as lab, x-ray, imaging. And we're going to go over all of those in just a minute. But we were able to cultivate and really create plans within an HRA for groups that were maybe small employers and didn't have to offer coverage. And so we were able to look at that and really incorporate into different plan designs. And what we'll talk about is how they capitate those rates. And it's almost like providing a miniature plan for a company. I'm not sure if that's making sense so far. Is everybody with me? Okay, awesome. Another thing, and I had kind of talked about it earlier, is also implementing in conjunction with this in ICHRA. Say maybe a group has a $200 budget and they wanted to implement direct primary care. We can have where, they implement the direct primary care, and then the additional money can go into an ICHRA account for them as well. So there's very creative different ways that we can utilize HRAs to be attentive to a company's budget and make sure that employees are getting taken care of. So let's take a look at some of those services you can add to your HRA with MyMD Connect. So the first thing that we have here are our lab services. And this is really impactful because a lot of employees utilize labs and they can get really costly, especially if you maybe have chronic conditions. And the last thing we want is someone to not go get their labs done because of the cost. And so one thing that MyMD Connect has done is they have gone in and they have negotiated cash prices with different lab like Quest Diagnostics and LabCorp and those types of places. And we are able to get the wholesale price of labs and we can incorporate that into our plan. And the really nice thing is then when we do this and we incorporate it into that HRA under that membership, it will cost the employee only $20 for them to go get all of their lab work done, which is amazing. I know I utilized this with my first, time I saw my doctor, and I spent, 45 minutes with them, and then they said, we're going to go ahead and do, your labs for you. It cost me $20 and it was super seamless. I never saw a bill. It was literally MyMD Connect coordinated it for me. They called me, they got my credit card information to charge me that $20. All I did was show up. There was never a bill. They took care of everything. And so it was easy for me. It's easy for employees, and the cost is absolutely amazing. So we are able to do this through capitation. The doctors are able to negotiate those rates and make sure that they take care of that. The next thing you can add under the HRA as an option to create one of these miniature plans that we have is X-ray and ultrasound. It works the exact same way as the labs and is once again only going to cost $20 to the employee. I actually used this on Tuesday. I was having some issues with my leg. And so I called and I talked to my doctor, and they were able to say, okay, you're sounding like it might be the bone. We can go ahead and do the x-ray. And so they kind of went through that with me. Someone called on our care coordination team. They scheduled the appointment for me. They were asking which location I preferred. And again, all I did was give that credit card. They charged me the $20 fee. And then I didn't have to deal with anything else. I just showed up. It was already paid for. And it was just an amazing experience. Good thing is that my x-ray came back clear, guys. So that's also awesome. But it was just a phenomenal experience. And again, for it to only be $20 was extremely impactful. Probably a year ago, I know I had an x-ray on my back and I ended up paying $150 for that x-ray. So this was, I don't know about you, I'd much rather be paying the $20 than $150. The next thing that you can add is our advanced imaging. So this includes CAT scans, PET scans, MRIs. And get this, if an employee wants to utilize this, it's only $200 for them. So we are able to contract and get them into an MRI CAT scan, which, as you know, can be extremely expensive. And a lot of times this is something that employees will put off care for because of how expensive it is. And so with MyMD Connect, your doctor is able to speak with you, coordinate that care for you as needed. And then for it to only cost the employee $200 is extremely impactful. So this is just another way that MyMD Connect goes above and beyond. So really excited that we offer this as well. Let's go ahead and then, I know I've been alluding to and kind of talking about these plan designs, but let's go ahead and take a look at what they look like. I'm pretty visual, so this might be more helpful for you to see. So this is what our virtual primary care HRA plan designs look like. So again, if an employer wanted to, they could add a traditional HRA to this where they say, okay, in addition to this, $500, or, the ICRA option as well, if that's something they wanted to look at as well. We can go through that. But you'll see here that HRA option 1 at our core is kind of just the very beginning. You have your virtual primary care, and then you have the prescription discount program that is available as well. It's included under that HRA, so it is a Section 125 qualified plan, so it is tax deductible for the employer, which is very, very nice. Then you have our HRA option 2, which includes everything that HRA option 1 has, but then it is going to also include your basic labs for employees. HRA 3, same thing, includes everything of HRA 2, but then it also includes your X-ray and ultrasound. And then HRA option 4 here is the whole kit and caboodle. You get it all. It's going to include everything of HRA 3, except also your imaging, which is that MRI, CAT scan, home sleep studies, all of that. So it's all included in there. So really you can see that this would be the majority of really every, employee's health needs that they need for the most part, so those everyday things that may come up that they need would be covered, and it's at a really affordable price. We're going to show you those pricings in just a minute, and I think you'll enjoy it. The brick and mortar for this works the exact same way. The plan designs are the exact same. It's just that you'll see this second line here. The line that says discounted will then change to included. So that's really, again, very similar to our Connect Health memberships, is the exact same thing where brick and mortar just includes that extra line item there. So everyone with me so far on this? Awesome. So the pricings for this, and I think, again, you guys are really going to like this. The virtual primary care, it ranges anywhere from, that $58 for that HRA option 1, and it can go all the way up to the price of $129. So that's really the price range that you'll see here, which if you look at that HRA option 4, think of how impactful that would be to go to an employer and say, I have something that's going to include all of your employees' primary care needs. It's going to include their labs, their x-rays, any PET scans, CAT scans, MRIs, home sleep studies, and I can give all of that to you for $129. I mean, that's crazy. So there's no loss ratios on this. I kind of like to consider it, although it's an HRA, so it's technically self-insured by the employer. It's, in my opinion, almost like a miniature, fully insured plan for an employer, because all the employer pays is that monthly fee for that employee, and everything is included there. So it's really cool when you look at it that way. And again, that's just so impactful. I mean, look at HRA option 3 is actually my favorite of the options, because I do use, lab, x-ray. I've already used them at my MD Connect in the last, 6 months. And so I'm able to get all of that if you're, have less than 25 employees for $91. If you have more than 25 employees, that $86. So extremely, extremely impactful. Another thing I did want to note, I know that we talked about in the Connect memberships, we have the family options as well. It works the same way for family as it does the employee, but I did want to mention, because this was a question I got the other day, is if we have employee spouse or employee children, it's just employee family. So even if you have just employee spouse, that's considered our family cost. So I did want to clear that up, because that was a question I got the other day. So this is our virtual HRA options, really amazing. Again, for instance, if you have an employer group, they say my budget is $300, you could say, great, we're gonna give you HRA option 4. Your budget is $300, we'll take out the $129, and now you have, what is that, $171 left. I think that's what it is. I'm terrible at math. Left if they wanted to put that in an ICRA or utilize that money elsewhere. So we can get really creative if we understand what that budget is for an employer group. For the brick and mortar, this is our pricing for brick and mortar. Again, a lot of people can utilize that virtual. I think it's really easy, but for some groups that want to have that reassurance of having that doctor there and wanting employees to go in and see those doctors in person, we do have our brick and mortar available as well. So again, it works the exact same as virtual, except it includes those unlimited face-to-face visits. So this is our brick and mortar HRA plan pricing. All right. Okay. So.
Wow.
Yeah, that was a lot.
That's a lot of good stuff. So Katelynn, now that you've explained all those options, who actually is the ideal client for these plans?
Yeah. Okay. So that's actually a really great question, John. So direct primary care can be implemented for any client, but it's how you implement it that really matters. So because of this, when we start having a conversation, the main thing that I need to know is, what is the goal of your client? So I had kind of mentioned this earlier, but you have to look at us as like a broker's broker. Once we understand what the client wants to accomplish, we can really help curate and customize solutions for them. So maybe that solution is only offering that HRA option because they have less than 50 employees, and they don't really have a large budget. But maybe it's also a large restaurant group or a convenience store that wants to offer something, and they have to because of ACA and they need to be compliant. So maybe we look at offering a MEC plan option with direct primary care. A MEC plan, usually kind of a cheaper option, but hey, at least employees would have that direct primary care and get the majority of their everyday needs taken care of. We could also then look at doing, we have a convenience store and we did an executive carve out plan for them as well. Or maybe it's a group that just has had really high medical claims and they're in desperate need of an innovative solution to help better manage their chronic diseases and reduce their costs. So whatever it is, once we know what their main goal is, we're able to really create a solution that helps the client and their employees, and then also in the end makes you as the broker kind of their healthcare hero. So it's really, really exciting, but there's so many different things that you can do. The opportunities are endless. I think for me, the biggest thing that I need to understand is just what are you trying to accomplish? What is your goal? And we can get really fun and have some conversations about creating something customized that they're going to love. I did get one from someone that asked if we can integrate with other self-funded plans. So I'm assuming you're talking about maybe you already have a self-funded plan with maybe Blue Cross or Humana, or you were working with a different TPA. Yes, we can integrate with those. It's just more seamless when it's someone that we already work with, but we can work on doing that as well. So yes, if it's self-funded or level funded, this pairs perfectly with that.
Katelynn, I'm sure a lot of people are asking, what's the process for someone to get a proposal from you?
Yeah, no, that's a really good question. So the process of getting a proposal is pretty easy, especially if you're looking for one of the HRA options. We can have conversations about that. For that, we really just need a census. That one's pretty simple. If you are wanting to do one of the health plans, that works very similar to how you have current health plans. If it's a large group and you're looking for self-insured, we need the census. We need some information on the company and then also some claims information. So that's the exact same process as what you're used to for getting a proposal like you normally are used to. Same with level funded, same information. That's all we need for that. So it says, what is the broker or agent comp? That's a really great question. On the direct primary care itself, it is $3 for the virtual, and I believe it's $5 for brick and mortar. Correct, Jeremy? I'm pretty sure it's $3 virtual, $5 brick and mortar. And then from there, if you add additional products, it's $2, for instance, if you wanted to add the labs, $2 if you wanted to add x-ray, and $2 if you wanted to add the imaging. So it really just builds from there. So at the core though, if you just wanted to do just the virtual, it's $3. And if you add others, it moves on from there. If you're doing a health plan, we can customize what the broker comp is for that. A lot of our brokers do a standard $35 or $40 for broker comp in that health plan, but you get to pick that rate and we can customize that for you. The next, I hope that answered your question. The next question that we have says, regarding brick and mortar, what is the network? Can employees keep their doctor? So that's a great question. The thing though is, in regards to keeping the doctor, we are the ones that go out and we recruit our doctors, because what we're doing is completely different than your normal fee for service doctor, where you're just going in and the doctor's being, wants to see as many patients as possible because they're getting paid for each patient they see, as opposed to a membership model where it's concierge medicine. You're spending 45 minutes with your doctor. Completely different models there. So in regards to wanting to keep your specific doctor, it is a different model. It would have to be a doctor that is a concierge doctor. Certainly if you have someone. Jeremy, did you want to chime in on that?
I did, because I read that question a bit differently. So
okay.
Katelynn said exactly right. The direct primary care and virtual primary care, this is a different breed of doctor. Mm-hmm. But if the patient has a primary care doctor, with a network, and you can put any network on these plans you want. We can work with any network, it doesn't matter. But more importantly, they can keep their primary care doctor that they have a relationship with. The direct primary care doctor, I do this all the time. Like if you like your doctor, and most people don't have this relationship, but when they do, that doctor's still not open Thursday at 7 p.m. and they're not able to see you tomorrow. That's just not the case in this world. So yes, they can keep that physician, and the DPC fills in the gaps. And I tell you, we end up doing more work for the patient and their primary care as that kind of backup assistant, after hours, weekends, things like that. But in most cases, patients don't have that relationship. I mean, if they did, then maybe this industry wouldn't be in such a mess. But when it's there, we won't disrupt that. We don't want to disrupt that.
Great. Hopefully, I'm glad that you read that differently. So hopefully that answered your question. The next question is, what is physician reimbursement under the discounted fee structure, perhaps best described as a percentage of Medicare? Jeremy, did you want to answer that question?
Yes. Again, you can design any type of plan you want. What we frequently do is use a Medicare reimbursement plan for our major medical coverage plans, and they run physician 130, facility runs between 150 all the way up to 200% of Medicare, depending on where we're at. And we do have the ability to put those types of direct agreements together. We've got many of them already established, but you can build the plan any way you want, and we can assist you. There was one earlier slide where when it said discounted on the actual DPC membership. So most carriers are going to afford you 60 something percent off. I mean, it's going to vary 5 or 6%. But when we do labs internally with direct primary care and they're not capitated, it's just the patient having to come to us to acquire something, we're at about 90% off bill charges, almost across the board.
I did want to go ahead and share here my contact information. If anyone does have any questions, if you are looking to potentially get a proposal, I'm happy to go ahead and work through that with you. If you have any further questions, please don't hesitate to reach out.